The New South Wales government will spend nearly $7 million over 3 years to crack down on black market vapes. It comes as the state ramps up its raids on tobacco stores, seizing more than 23,000 illegal vapes over the past few weeks. Joining me live now is New South Wales Health Minister Ryan Park. Thanks so much for your time, Minister. First of all, is this just tobacco stores, or are we talking these black market illegal vapes being sold in convenience stores?
Yeah, we're trying to crack down on wherever these stores are selling these illegal vapes, most of which, Laura, contain nicotine, and we want to try and do our part in this challenge, and that is by cracking down on retailers who are selling these products, particularly to young children, when they simply shouldn't be. What we're seeing is very young children getting almost a nicotine addiction at a very, very young age, an addiction that is hard to get off, and an addiction that the Chief Health Officer, Kerry Chance, said yesterday is controlling their lives.
Yeah, but if you're trying to control the black market, this needs to be done at a federal level, because really anything you do in New South Wales is not completely futile, but is only really going to make a dent. Don't you agree?
We certainly need to be working with the Commonwealth Government. I know that Minister Butler is putting in place measures through the border controls and border force around trying to control and better control the importation, as well as develop a legislative framework around this issue. But Laura, look, as a parent of two young boys, one of them which is starting high school this year, this is an issue that personally concerns me enormously, not just as the Health Minister, but as a parent. And I don't want the New South Wales Government to sit by when we can also be playing a role in trying to address this challenge. It's an issue that many, many parents and families have spoken to me about. They're extremely concerned about, particularly the addictive way in which nicotine can get a grip on young people.
Yeah, early on, when Chris Minns became the leader of the Labor Party, he promised that he would put a vape detector in each and every school. We haven't heard a lot about that recently. Is that still going to happen?
Yeah, we're working with the New South Wales education sector around that, and no doubt there'll be more to say through their minister as time comes. But I've also got a significant role to play in both informing young people about the dangers, which is where part of this close to $7 million will be going to, as well as making it very clear to retailers that they have a responsibility, and that we will have more people on the beat out there inspecting these vape stores to make sure that they're not selling products that contain nicotine, especially to young people at the end of school or the beginning of school. It's simply something that has to be addressed. We are going to try and get on top of this. It is a challenge, you are right. One of the big challenges is the importation of these devices, and we have to work with the Commonwealth Government about that. But I don't want to sit idle, given the concern that parents and families are expressing to me almost on a weekly basis.
Yeah, an explosion of vaping among school children. That's what it's been described as by health officials and others. But, Minister, on these vape detectors, this was clearly one of those, perhaps a thought bubble from Chris Minns at the time. So if you don't know about these vape detectors and this plan moving ahead, does that mean it's not going to move ahead? We're talking about these vape detectors costing about $2,000 a unit, and you need 40,000 across New South Wales. It doesn't seem like a good spend if it's going to cost around $80 million. Well,
look, no doubt New South Wales Education, who are responsible for our schools, will be looking at that particular issue. Yes, I am aware of it, but it is no doubt something that schools are looking at and will be focused on a part of their measures, and whether it can be rolled out in the way first committed to, we'll have to have a look at that. But I've got a job to do in this space too, Laura, and that is focusing on making sure that an awareness campaign that targeting young people is out there, and making sure that retailers are doing the right thing as well.
Yep. I'm just wondering about the vape detectors again. I know this is perhaps not directly within your remit though, but do you really think this is the best way? Teenagers are pretty crafty. They tend to know how to get around these things. It might be a waste of money. Do you concede that? A vape detector in toilets in public schools? I mean, it's not going to stop kids from vaping, is it?
Well, the teenagers are pretty crafty. I've got a teenage son, so yes, I'm well aware of that. Look, we'll have a look at the technology. We'll have a look at whether we can roll this out in a trial form to see if its availability and success. Look, we're a government. If someone thinks that we can be doing something better, we'll have a look at that. I'm all about that. I've said that from the very beginning of this taking over for this portfolio. I don't think all good ideas come from one area. If there's an area that we can be focused on to do something better, then we will. Vaping is something that, Laura, to be quite honest, we're going to continue to have to look at, modify and evolve because it's evolving. It's a very different product to tobacco. It's very different than what it was 3 or 4 years ago. There has been an explosion of it. It means governments need to try and keep up, and that often means changing the way we do things and being flexible in the way we roll out initiatives. That's a reality of it.
Yep, absolutely. Well, I don't think there was any money in Labor's first budget in over 10 years to do this, so perhaps it has quietly gone away, but I will follow that up, Minister, with the relevant minister. Before I let you go, I do want to ask you about the COVID inquiry. I can't find anyone who thinks that the terms of reference handed down by Anthony Albanese and Mark Butler last week suffice. For you, what would your local community expect? Would they expect an inquiry to look at whether a state government, a premier, could again put their schools into lockdown, put them into lockdown in their homes, or even, have police patrol their streets, making sure that they were doing the right thing? Surely your electorate deserves to know all these things in the event of another pandemic.
Well, look, what I think my community and the communities around New South Wales expect is ministers at all levels to be making sure that they're capturing the lessons of what went right and what didn't go so well during the pandemic, and how we can improve that.
What didn't go so well, in your view? Now that you're the State Health Minister, what didn't go so well? What wouldn't you do again?
Well, for a start, I think we need to work on our communication, particularly in diverse communities where English is not their first language. I think we could do some big improvements in working together at the state and federal level with the rollout of a vaccine. I thought that was slow, I thought it was clunky, and I thought it wasn't clear about what people had to do. I think we need to next time simplify the public health messages that we are giving out to communities, particularly communities.
Okay, let me ask you this, Minister.
English is not their
Would
first
you
language.
put Western Sydney and just Western Sydney under a curfew again? Do you think that would be warranted?
Well, no, I can't say yes or no. I don't think it would be warranted, but I can't hypothecate.
Isn't that why we need an inquiry to look at that?
I'm facing with. Well, we've already looked at this. A part of our challenge here in New South Wales, Dr. Chan and others have looked at some of the measures that we did, but those decisions around lockdowns were taken at the time by a crisis cabinet. So I have to be respectful of the fact that I wasn't in that. I wasn't getting that advice. I wasn't aware of the decisions and why they were making those decisions.
Isn't this the whole point of having an inquiry look at it? Because, yeah, you're absolutely spot on, Minister. I mean, if you were put in that decision, that position again, you now have the benefit of hindsight, but it doesn't seem like this federal inquiry will look at that. Don't you want those answers?
Laura, what I've said to New South Wales Health is two things. Anything that the federal inquiry wants, I want them to provide, and at the same time, we will be providing a response to that inquiry about some of the detailed lessons that we feel we have learnt here in New South Wales. That's something that is important to me, Laura, because to be quite honest, I want to make sure, and the community I think would expect me to make sure, that if there are lessons learnt, we put that in place next time we face one of these pandemics. That's what I expect of myself. That's what I expect of New South Wales Health, because I think that's what the community expect of me.
Ryan Park, always good to have you on the program. Thanks so much for your time.